Okay, welcome back, guys. It's Liv.
Hey, Liv, I'm Mike.
We know who you are.
Well, it's Liv and Mike, and we are here on my first rodeo. We're so glad to have you guys with us, and got another great guest today. We'll get to him in a little while. But what you been up to?
Let's see. I was in the ER last week.
Oh no, I didn't know
Yeah,
that.
I
How did I not know that? Are you like a candy striper there? Is that your side hustle?
I definitely have paid for their electrical bills a few times.
Wow.
How much I'm there.
What's your deal? Do you want to share? I don't want to violate HIPAA on air.
I was working from home, and I stood up to
You had a workplace injury in your house?
Yeah, right? Who am I going to sue for that? I mean, that's probably why they have us working from home
That's a really
these
good legal
days.
question.
I know. Yeah, I mean, we're the lawyers, sir. I don't know.
I don't
I guess
know.
we could say,
If
but
you're doing work, if you're typing and you have a carpal tunnel, I think you could definitely sue.
so I stood up to go get lunch, and my wiener dog was under my foot, and
Yeah.
I didn't realize it.
By the way, my girlfriend said I made too many wiener comments, so I'm just going to let that one pass. So you go on.
Okay, so I almost stepped on my wiener, and I didn't want
Come on.
to. So I put
That's not fair.
I put my elbow down on the desk to not step on him,
Right.
and then my elbow popped out of place, and it hurt, but it didn't hurt too bad. But then I got really nauseous and hot and clammy, and
Have you thought about sending that dog to a farm? Because every
I know,
every
know.
injury you have or the dog
know.
has
This
is based on
dog-
its residency with you.
This is the most expensive.
This is Griffey, by the way.
Yeah,
Griff,
this is
what's Griffey's Instagram again?
Oh yeah,
For our
Griffey.
listeners.
Griffey gets it.
Apparently Griffey's having trouble getting it.
Griffey gets it. Griffey gets all the money I make because
Yeah.
every time I turn around, I'm either spending it on. Oh, and I had to take him to the vet last week.
Didn't you say it was $18,000 for his most recent surgery? Or
Well,
was it more
that
than
was that was 4 surgeries.
Okay.
But I had to take him to the vet again last week because
Yeah.
he lost his toe because he was digging and his toe got stuck in the chicken wire.
Is he like a truffle dog? Is that?
He likes to dig, and I
Yeah.
had him digging.
Lost a toe?
I had him digging because our plumbing wasn't working, and we needed to
You
find
needed him to find the line?
that thing that you open and you stick a snake
Yeah,
down
the
it.
valve?
The
So
guy-
you needed, let's just reset. You needed your wiener to screw.
I needed my wiener to come dig. So he was digging to find this clean out because it was under the ground.
The wiener was trying to find the hole.
So he found it.
Sorry, you see what you started?
So I don't know how this story got so convoluted because
Okay, your wiener
these
lost a
are
toe.
multiple. But yes, Griffey is a very. And I keep saying I'm never getting a wiener dog again. But then every wiener dog I see, I'm like, I have to have that wiener dog.
But is it because it's that? What's a wiener dog called? What's the name so I can stop saying wiener? A dachshund. That's what they're called.
Yeah, a dachshund.
What is what's the correlation between it being a dachshund and having all of these problems?
I think they
Or is it
just
just you as a dog owner?
No, I think the dachshunds in general, they have very unique personalities.
Yeah.
They're spunky. They wiggle their butts. They're
Right.
they're honey badgers.
Those are good things, but your
They're-
dachshund seems to be
He's
a
he-
magnet for trouble.
He's a honey badger. He don't
Yeah.
give a beep. He does what he wants on his own.
I think you're associating your personality with your dog, and that's really not fair to your dog to have to carry
Wow,
that
I'm
burden.
kind of honored that you would call me a honey badger.
Is that a good thing? Did I just violate
I
some
mean,
sort of workplace protocol?
One time I had a boss tell me I was an alligator in a pool of sharks.
Alligator. That would be that alligator wouldn't do very well.
Really?
I think the alligator would get its ass kicked by the
No,
shark.
I
It's in a
don't.
pool. So anyway,
Anywho,
alligator pool of sharks.
I was the alligator swimming with sharks.
Uh,
And I took that to mean I was still tough, but in a different mindset as everyone else.
yeah.
I don't know.
I don't know. I think
But
it's
I guess-
actionable.
But I guess you called me a honey badger.
No, you called your dachshund a honey badger, and I said you were associating your dachshund's personality.
You
with
don't think
yourself.
I'd be
You were
more of
projecting.
a ladybug or a butterfly?
You're looking at me as if I should say yes, but don't see it.
I want to say that you're a turtle, but that's just because I
Yeah.
feel like you're bald.
I do seem like
But
a turtle.
I feel like personality-wise, you're not a turtle.
No, I'm definitely not a turtle.
What do you feel like you are?
I'm slow and steady. I don't know. Is that like the spirit animal analysis thing? I've never actually done that.
Really?
Nah. What's yours?
I would say I don't want people to take this the bad way, but I feel like I'm a snake.
Huh.
Not in a bad way, like
Yeah.
a garden snake.
Oh, those good snake qualities.
I'm a garden snake.
Yeah, they're useless, aren't they?
Like, no, they're not useless.
What do they do?
They aerate your yard.
You don't know
Like
that.
they're they're beneficial behind the scenes.
All right. As far as we know, I think I'd have to. I'd probably be a monkey. I mean,
Mm.
you know, not that I throw my shit at people, but well, maybe I do actually. So I'm a monkey. This is going to be a great transition to our guest because we've actually got a very intellectual guest today. I don't know how he'll resonate with our brand of humor.
I know his
But
IQ must be so high.
yeah, he's really smart. This is the funny thing. I mean, I was thinking about the guest, and he was one, or at least the category of him is something I thought about when we created this show, and that is people often ask, what's so bad about your first rodeo, or it ain't my first rodeo.
Mm.
But also, people are very quick to say it ain't brain surgery. Our guest today is a brain surgeon.
A neurosurgeon.
I think that's the brain, right? The whole nervous system.
Yeah, because I read online neuro connects to your spine. So he'll do like brain and spine.
Yeah.
And then neuro is also connected to like neurons,
Right.
which is pretty much Parkinson's disease and those types of diseases
Right.
that get, I mean, I don't know the
Yeah.
names of them. I can't even tell you the difference between a nucleus and an atom, to be
No,
honest. I know
he's-
what they are. I still don't think they exist.
No.
But no,
All right.
I think science
Today's not the day for that.
No,
you
I know.
ask all
Today's
your
not the day,
anti-science
but
questions.
I do think science is a conspiracy theory.
All right. Well, I would like you to pose that question to our guest today, Dr.
Maybe not.
Ali
Maybe-
Chahlavi. He is a Georgetown University School of Medicine educated doctor.
He did
and
his residency at the Cleveland Clinic.
He did indeed. And
That's
an internship
crazy.
there as well. And
Yeah.
guy speaks at least 3 languages.
4 languages.
It said 4, but I got to be honest. There's
It's
a
French,
typo.
English, Farsi, and
Yeah. What was the 4th? It said unders.
that's
so,
probably a language that we're just
It's
not
not. I
educated
texted
on.
him, and he's like, "That's a typo."
Oh, so 3 languages. Probably, I mean, honestly, medicine is its language of its own, so just keep 4.
A little bit of
Just
Latin.
keep 4.
Anyway, sweet guy. I think we're gonna enjoy him. So let's welcome
It's
to
gonna
the show.
blow your brain.
It will blow your brain. That's probably why you're not a brain surgeon. Welcome to the show, the amazing, the funny, the humble, the really cool Dr. Ali Chahlavi.
My first rodeo. My first rodeo. My first rodeo.
All right, so Ali, before you joined us, I gave you an amazing introduction, and I talked about the fact that you went to Georgetown School of Medicine. Liv jumped in and said you were
At Cleveland Clinic.
yeah, exactly. So and we talked about your languages, but so anyway, pretend we already introduced you.
I love
Ali
that.
Chahlavi.
I love that. I don't know what happened with that. That was
Oh, yeah. What I'm guessing, did it say? Because what his resume says, it says he speaks English, French, Farsi, all true, and unders, which I thought might be Urdu, which is a language. I would have thought maybe Arab, or maybe it meant to say others. Maybe it was. What do you think? What do you think
and
unders
it
was?
wasn't me who wrote that. It was just somebody in the marketing department. Well, that's funny. That
It is pretty funny. I'm glad.
I should
Nothing
have
else
just
counts.
played it along and say yes. Of course, there's a dialect in Iran. They speak unders.
Yeah, I felt really bad because I went to one of my partners from the Middle East and I Googled, like, is there a language called unders? And it was, it didn't lead me to very good places. But anyway, if nothing else comes from this interview, hopefully they'll be able to improve your resume.
Yeah.
So thanks for joining us, man. When we started this podcast, I was telling Liv, the premise is, first rodeo. What's so bad about your first rodeo? Talking to brilliant people and famous people about the first time they did something, and so I immediately thought of you, and I thought of there's got to be a first time you do a brain surgery, but I also thought that just like rodeo being sort of cliche. Besides rocket science, people are always saying it ain't brain surgery. And yet for you, every day, or quite frequently, it is brain surgery, huh?
Yeah. I mean, again, as a neurosurgeon, so, we do both spine and the brain. So, so obviously spine is more common than brain surgeries, but, so for me, it's like, let's say 85% spine, 15% brain. But like you say, yeah, we do brain surgeries. So
That's crazy. So you, I mean, and obviously the spine is just as consequential because basically it's game over. Should you do something wrong? Not trying to make you nervous for your surgeries tomorrow, but that's an amazing amount of pressure. And I've known you for a while. You always have this beautiful smile. You're a very handsome doctor, and you
Mike,
see,
enough.
yeah, no, you seem very unflappable. Is that common amongst people in your specialty, or is it just a unique quality you bring to the table?
yeah, I think everybody's different. I mean, it's my personality. So we actually, yeah, I mean, nowadays I think doctors are definitely more, surgeons are more pleasant than they were in the past. I think we have a more human side to us than what it was in the past. I think everybody's like that, right? I mean, I think people are more down to earth, hopefully, but I guess not politicians. Politicians are not.
Yeah, we're you keep
Yeah.
in mind, Liv and I are both lawyers.
Yeah, we're both attorneys,
We're
so
pretty inhuman. We've got no.
yeah.
They're more entertaining. I want to ask you about some of your firsts and welcome you to share that with us. But what's the average length of some of your surgeries? I mean, some of them are not even the average. Some of them can be. What's a long surgery for you?
Okay, so for me, I've been in very long surgeries during training, and they can get over 12 hours long. I mean, some of these surgeries. I personally
For our
enjoy,
listeners, that's like a whole season of Yellowstone, basically.
yeah, no, seriously, but I enjoy more, shorter surgeries. So for me, surgeries that are anywhere between 45 minutes to 3 hours. That's what I usually do. I try to keep it there, and I'm fast. It's like I've done this for so long that my techniques have gotten very efficient. So I do them very efficiently. But the surgeries. So for example, I mean, there are surgeries that I do in 3 hours, and somebody who's not used to them can take 6 7 hours 8 hours in some of these
Wow.
surgeries. But I like to just one of my mentors was that I really appreciated when I was training. He mentioned is that you should never rush, but you should also use every move very carefully and be efficient, and that stuck to my mind. So that's what I do. I try to be as efficient as possible when I'm doing my
Really
procedures.
good. I wonder, like, if you get to your limit, say 3 hours, is it like a therapist where you're just like, That's all the time we have"?
That's right, just stop. Okay, walking out. No, I wish. No, 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 but I plan. So obviously we plan our surgeries, and yeah, sometimes it goes longer, and it gets tiring. I mean,
Yeah.
it's like, when they're long and you're just standing on your feet and you're doing this, and it's especially spine. It's physically demanding. It's very, you're wearing a lead, and there is instrumentation you're putting down, so it's very physically demanding. And but you were mentioning first time. I remember exactly my first surgery that I did on my own. And it was when you're in training, there's always somebody who comes out and kind of watches you. Even as a chief resident, you do the majority of the procedure by yourself, but there's an attending next to you. Somebody's watching, and later kind of checks, make sure that everything is going well. So the first time I did a procedure, I was very nervous. I mean, the evening before, I was like, I'm on my own. I'm like, shoot, nobody's going to check on me, and it's all on my own. And I remember that day, and it was a very simple surgery. It was like it was a laminectomy, microdiscectomy.
Yeah, you've done a few of those,
Totally,
haven't you,
yeah.
Liv? Yeah.
Yeah.
We've each done
Yeah.
Those were easy when I
Yeah.
started. I mean,
Yeah, and it's simple. So seriously, for neurosurgery, that's like one of the easy surgeries to do. Straightforward, simple. And but I'm glad that was my first surgery on my own. And I was like thinking, gosh, this is so different. Nobody, it's just me. And I really started psyching myself out because I was like, I'm I'm it. This is it. I got to do everything on my own. I got to get. I mean, I have to do a good job, and and the surgery went like great. It went great, and I finished and closed, and I was like, wow. You know, I don't need anybody next to me to watch over my shoulder. This is a piece of cake. And then it was great. After that, I had tons of confidence. I was like, I don't need anybody next to me. So the
Wow.
first case started building my confidence.
That's nice. And we usually ask guests to talk about mistakes that they've made. We will not be asking you. As lawyers, we would advise against you.
Yeah.
I'm sure you've never made a mistake, but our last guest was a broadcaster. I'm sure it's
So
always been perfect.
when you're in your really long surgeries, is it kind of like football players on the sideline they'll come up like with a Gatorade bottle and squirt it in your mouth, or like
Well, that's a good question.
can you have some like goldfish, like because I'm sure like
Yeah,
you're thirsty and you're hungry and you need some like chocolate or something to like spruce you up like
that's a
hour
good.
6 or 7.
That's a good question.
Yeah. So I mean, the way it is that during the surgery, I think there is so much focus in what you're doing. You don't think of anything else. At least I think most of us. I just focus, and I'm not thinking about. I mean, I can go on for 4+ hours, and I'm not thinking about bathroom, food, anything. It's like
Wow.
obviously, because you have to use the pedals with your foot, you got to use bipolar drill. You got to move your foot around. You don't want to be on one foot all the time and use one foot to do everything. So one thing I always do, I alternate, and I move my drill from right to left with my foot, so that it's like, so I can use both foot, so I don't hurt one leg more than the other.
Is this for robotics, or is this for robotics, or in general you're drilling with your foot?
In general, in neurosurgery, we drill, for craniotomies, we have to drill the skull, and in the spine, we have to drill the bone. So we do that. And then bipolar is cauterization. So you need I use the foot pedal. So, so basically it's like acceleration, but instead of like only using one foot, it's like, you can move the pedal around to
I
to use
see.
both. And we use the microscope, thank God, in most of the procedures we do, so that we're not looking down. I mean, after a while the neck starts getting tired, so you can keep your neck straight and look at the microscope. So as far as thinking about anything else, I don't think of anything else. I just do my procedure, and if it's a difficult procedure, obviously there's more concentration. We don't listen to any music, but if it's a procedure that I do regularly, we have music in the room. So
What's your go-to? What's your jam? What's your jam? What's your go-to?
I
Music.
just let the nurses or my PA pick the music. I don't if it's craniotomy, it's basically a smooth jazz. It has to be very mellow, very calm,
Yeah.
or classical music or something like that. I don't know. It's weird for brain surgery. I want very simple or
Right.
calm music.
Not a lot of gangster rap when you're
No,
when you're
2
drilling.
chains.
Yeah, that makes sense. Tony, you had a question.
Do you stand on like some sort of anti-fatigue mat or a relief mat? Do you have a recommendation for one of those if I'm going to be standing for 12 hours? I got to know.
Because Tony's thinking about becoming a brain surgeon.
Part-time only.
No, a lot of people have a mat that they stand on. I have just very comfortable shoes. My shoes are very comfortable, so I don't use a mat.
What do you wear? Maybe we could attract them as a sponsor. What kind of shoes you like?
I don't have the name of it, but it's like the regular scrub shoes. Those, they're thick and
Oh, the clunky ones.
Oh, like what do you call those?
They're
Slippery
like
things?
they're kind of like do they
Crocs. Is
like
it
the
Crocs?
clogs. They're
but they're not just the regular croc. They're, they're, I forgot what they're called, right?
I know what yeah, they look like clogs, sort of.
Mm-hmm.
Yeah, I've seen
Yeah,
them.
they're
They're
slip
not
on.
cute.
You put it on, but they have a thick sole and a lot of cushion. Very comfortable.
So, what's a surgery that you do every day now that when you were first starting to do it, it was just so terrifying to you?
Actually, I'll tell you, it's like when I started, I was, and I think it's like this for most surgeons too. When you start, you're more adventurous because I came from the training from Cleveland Clinic. When I came out, we had done cases that no one else wants to touch. So, I mean, I was very fortunate to have a great training, and so when I came out from training, I felt comfortable. Once I finished my first surgery, and I was like, wow, hey, I got my confidence. I was more willing to do difficult cases than I am now, believe it or not. I mean, I enjoyed, for example, doing brachial plexus tumor surgery, which I will not do at all. I mean, I would open up like the pectoralis muscles, major, minor, to go into the brachial plexus to take a tumor out. I'm not going to do that at all at this point. No way. The reason I was doing that is because I finished training. We used to do brachial plexus surgeries. We used to do cases that after, like that I was used to. So I felt comfortable doing it. So it's kind of the opposite. Now I do procedures that I do regularly, and I don't like to do procedures that I haven't done for a while, which is normal, right? I mean, and then that's what happens. People specialize more in an area. I just got very efficient and much better in what I usually do, and which is mostly spine and and craniotomies for brain tumors. I don't do skull base, for example, much, which I used to do a little bit more earlier on. We used to do a lot of aneurysm cases when we were in residency, and the board of neurosurgery recommended that not to do any aneurysm surgery if you're not an endovascular, and I stopped doing it. So now I would definitely not touch anything. So a lot of things have changed to the better. But the cases that I do now, I'm very, very comfortable, and I've done thousands of them, so for me, it's just less stress.
Yeah. One thing I'm pretty sure you explained it to me we were at something for our kids one night, and I was probably asking you a lot of dumb questions, but I didn't appreciate this. Maybe some of our listeners don't. That I've never had the misfortune of needing spinal surgery, but when I think of the spine, I think of the back. You get a massage, you get your spine massaged. Most of the surgeries you're doing on the spine are on the other part of the spine. So you're going through internal organs, you're going through throat, you're getting to the spine, the more important part, if you might say it, on the interior side of the body. Is that a fair statement?
Yeah, so spine, so for the cervical, you can go from the front and the back of the neck. And the thoracic spine, we go from the back. For the lumbar, majority in the back, from the back, but you can also go from the side, and you can go also from the front, but majority from the back in the lumbar spine. And so when we say spine surgery, that means we got to go through the skin, through the muscles, into the bones, and then if we go from the front, like in the if we're doing an anterior lumbar interbody fusion, you got to go through the organs and get to the front of the spine. And then the cervical spine, which is very common surgery, again, you go in from the front of the neck, you got to go into between the layers of the neck until you get to the front of the spine. I mean, you got to go past the carotid sheet and the carotid, the jugular vein, and get to the spine.
Well, and I'm hoping our listeners aren't eating lunch while we're talking about this, but is that all you, or do you have teams of people that deal with those other organs that are helping you get to where you need to go?
So for cervical, anterior cervical, for example, if you do anterior cervical discectomy and fusion, it's just me, and I have a physician assistant. They help with retraction and irrigation and suctioning to provide visualization. And then for the lumbar, if you're going anteriorly, yeah, you have a access surgeon. You use either a general surgeon or sometimes a vascular surgeon. Um, if you Obviously, if you go from the back of the spine, you don't need any access surgeon. You just do it yourself and your physician assistant or nurse practitioner. If you go laterally, you can do it yourself too. We don't need any access surgeon. So for the brain, we don't need an access surgeon. You do everything yourself. If you're going through the nose to do like a transsphenoidal, you use a ear, nose, throat doctor. It was like one of the first things I learned when I went to private practice was that my partners were saying, listen, I know you can do it. You can go through the nose and do it yourself, but if anything happens to the nose, they can say, hey, you're not a nose doctor, so get
Right.
and that's why you should get the specialist. So a lot of things we can do on our own, but in private practice and now even in academia, I mean, people just go and get their access surgeons, the specialists who does it, and it is safer. It kind of it's interesting nowadays. Medicine and even surgery, we're really focusing more and more into specialties. Where in the past, I mean, I don't know the history. I don't know if you know the history of neurosurgery. There was no neurosurgery. It was just general surgeon doing brain surgery. It was like general surgeon who liked to do brain surgery, and they were doing brain surgery. And then they got into specialty, neurosurgery, and then the neurosurgeon was doing everything. And then now they have subspecialty. We have pediatric neurosurgeon, we have vascular neurosurgeon, we have, spine neurosurgeon, cranial neurosurgeon. You go to academics, the cranial neurosurgeon will not touch the spine, and the spine neurosurgeon will not touch the brain. Even in private practice, there are a lot of neurosurgeons who only do spine and don't even touch the brain. So things have really everything is very, very specialized.
Yeah. Speaking of specialties, going back to when you were in med school doing your rotation, was there a certain specialty that you had to do surgery or you just couldn't stand the practice and you were like, once you walked out of there, you were like, oh my gosh, I'm never doing that again?
Mhm.
Tell me. In
She's
medical
asking, is
school,
there
was there
something you
any
hated?
rotation that I was like, I'll
Yeah,
never do this?
was it
Yes.
like OBGYN or like derm? Like what were you like, oh, how do people do this?
Foot doctor. It was foot doctor, wasn't it?
Yeah. So I don't know. I mean, yeah, no, there was definitely. I mean, OBGYN was fine. I didn't mind that because it was surgery. For some reason, as soon as I started surgical procedure, I was like, I love this. I love the OR. And then let me tell you, pediatric was a nightmare for me.
Really? Was it because of like dealing with kids or was it just a different world?
No, I just had a very bad experience. I mean, my rotation, the mentor for my rotation was really difficult. We were asked to pick when on the first day of the rotation. They said you can pick either one difficult patient or have multiple simple ones. I was like, okay, I'll take one difficult one. Oh my God, it was a very difficult patient, and it was just I was not interested in it, and I like to deal with the patient themselves, but in pediatric, you don't deal with the patient. It's like you're going to deal with the parents mostly, with the uncles, with the grandparents, and I'm like, oh, it's just a different world. It's a very different world, and for me, it was just something that I was not interested at all, and I like to I enjoyed more rotations where you get um, uh, like a result after you do something. So in surgery, you get a result. You go in there, you fix something, you come out, and you achieve something.
Yeah.
Where for me, pediatric was very different. One, you couldn't even interact with the patient most of the time. It was really social thing with the family and trying to please them, and
Yeah.
And it's interesting. My wife is a pediatrician, so
I was
thank
gonna
God
say,
my wife
yeah,
is a
yeah. And I
pediatrician.
was a pediatrician.
Yeah,
That's
yeah. Thank God she's a pediatrician because I couldn't do that. And the other thing, the other rotation, I didn't mind. It was very intellectual, and I think internal medicine, it's great. But for me to discuss, um, you know, that's what they do in medical school. I mean, they try to teach you as much as possible. But we would do these rounds about sodium levels, what causes the sodium to go up and down, and it was kind of like
Burger King, right?
exhausting.
Was
We
it Burger
would see
King?
one patient and talk about him for 30 minutes, and I was like, oh, we got 30 more patients to go see, and it's like, a lot of talking and less action. I liked action. I'm like, let's go and fix something. Let's go and neurosurgery was amazing for me because I loved to study the brain and the spine and the nerves. So not only it was interesting surgically, but it was very fascinating for me. So neurosurgery was definitely the best thing.
I never thought about it, but like, I mean, basically, you're dealing with anesthetized people. So, and in
Kind of
fair,
nice.
what?
It's like kind of nice that
Yeah,
you're
if we
just
could do
like,
that with our
shut up.
clients,
Yeah.
that'd be amazing. If we could just
Yeah.
give our
Well, in surgery,
So,
obviously there is, but you have to see them. So clinic, we'd see them in the clinic, but you
right.
diagnose. Um,
so
the nervous system is very interesting as far as the different functions it has, and it still has a lot of mystery in there. And there's still a lot of more knowledge to capture. Still, I mean, we have to discover new things in the brain that we haven't found yet. So so that's fascinating. I mean, so even in clinic, I really enjoyed the clinic. You see the patients, you find a neurological problem, you can diagnose things, and for me that was so it's not just the surgical part, but the clinic. Now, let me tell you, now it's like surgery is great. I love to do the surgery, but I think the biggest pleasure for doctors, surgeons, and even doctors is helping people. So
Mm.
now let's put the science to the side. Is, gosh, you're helping somebody. You're helping them to have a better life and better quality of life, and I think that's the most rewarding part of medicine.
yeah.
Yeah, I mean, that's obviously, and I know that's your heart. It's got to be. I mean, the healthcare system needs some work. It's come a long way, has a long way to go. Is it ever frustrating that it's not more integrated between nutrition and mental health and physical health and everything in between? I mean, you have a specific skill set, and you could only do so much with your skill set. Is that frustrating for you?
Well, it really depends on the program you're at. I mean, that is the goal. I mean, you're saying it correctly. It's more a lot of interdisciplinary programs. We're trying to combine a lot of different disciplines so that we can work better together. It's like, for example, for brain tumor treatment, we need the oncologists, we need the radiation oncologists, we need the radiologists to find to help us with the reading of the radiology, or to be able to find the tracts. Sometimes there's special softwares we need and things like that. So radiologist is very important. The neuropathologist is very important. So it's a multidisciplinary approach to a disease, and a lot of hospitals, they move that way. And the frustration, I'm sure, I don't know how it affected you guys, but in medicine, the frustration is after COVID, we lost a lot of staff, and I don't know where they are. Honestly, I have no idea. I mean, it seems like that happened to the entertainment business, to restaurant business, to airline businesses. They're, I don't know, 50% of them are gone. And
Yeah.
so the difficulty for us is, right now we have a lot of patients cases to do. There's not enough nurses. We can't we're limited. It's like a bottleneck of what we can do because we don't have help now. It's amazing. I don't know where they're gone. I mean, I
Yeah.
Yeah.
ask people, and I've asked many people, where's everybody?
Yeah, where'd the
right?
people go?
They found something
I
better to
know.
do, I
So I
guess.
have a like a question.
That's a
Well,
good, Debbie.
it
That's
is a
kind of what we should do
question.
here.
So you know, like the saying, like, oh, she only has two brain cells left or whatever.
That's
So
you heard people say that about you?
yeah, you know, whatever.
I've never
So
heard
like
that.
when you open a brain, can you tell if people have been like on meth or like alcoholics, or does the brain look different
Oh.
per what substance you're on? Or have you ever had a patient that's like, oh, I'm totally clean?
She's asking for a
And then
friend.
you open their brain and you're like, BS, like your brain is mush. Like, does that ever happen?
Well, the good thing about imaging is like we always have an imaging before we do the surgery, so we get an idea how their brain looks like. Thank God. So we're not like exploration surgery, like the good old days back before they had an MRI. So we always have a good MRI, so we kind of know what's going on in their brain before we go in. But so I'll tell you this: people who drink a lot of alcohol, they get brain atrophy. I mean, you can see that on MRI.
So what does that mean though for like someone who doesn't know what, like a lay person like me? Like what is atrophy? Or
It's dead. It's like it's
like
not no
is it
longer
a
alive.
different
So
color? Does it have
atrophy,
like
atrophy means the brain has shrunk down. It's like it's they lost, like, it's like if the brain is nice and full, it's like shriveled up and it's smaller. So they lost brain cells. And yeah, it's true. I mean, it is genetic. There's a lot of genetics to it. I mean, don't get me wrong. I'm not saying like everybody that drinks like goes out and drinks a little bit, they're gonna lose a bunch of their brain cells. But
Like who
people
drinks a
who
big
are
right?
true alcoholic and
yeah,
they're drinking every day, I'm talking about those people.
yeah.
They, on average, and everything is on average. I'm not saying, you understand what I'm saying, but on an average, they have more brain mass loss than somebody who doesn't.
Is it the same with people that do like drugs or like smoke or whatever?
That one, I don't know if there's a correlation um, with the brain cell loss, but again, doing drugs, you lose the brain cell. But it's just not like usually people who do drugs, they also drink a lot of alcohol, so it's
Mhm.
difficult to
Yeah,
see
same here.
that. Yeah, but it's not like the color is different. It's not
Mhm.
like their shape is different in their brain.
Yeah.
Um,
You ever get surprised? I mean, you say you got the imaging, like back to your residency or at any other time. To the extent you can say, what's the most interesting thing you've ever found inside somebody, or when you gone inside that was like, huh, never seen that one before,
hmm. uh,
or is it pretty predictable?
no, there. I mean, there are times we go in and we're surprised. I just nothing is jumping out and at me.
I know my daughter got a bean stuck in her nose once. You pull a lot of beans out of people's nose back in your residency.
No.
Never.
Oh, no, 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 no. But I tell you what, though. No, I tell you. So no, we had a very. Um, I mean, it's not a great story, but I mean, it's a little bit of a sad story. But it's basically somebody in jail that wanted to commit suicide, and they they had glasses. You can't have anything sharp, but they had their glasses. So what does he do? He goes and breaks his glasses.
Right.
He takes the handle part, sticks it in his eye, pushes it all the way to his brain.
Oh no.
Yeah. So he does that. He doesn't die. He just bleeds from his eye and then passes out. They find him. He's still alive, completely
Yeah.
intact. They bring him to Cleveland Clinic, and we couldn't even see the handle of the glass anymore. But we got an X-ray, and we see this thing's all the way from the into the middle of the brain to the back, almost close to the back of the head, inside the brain.
Ooh.
It missed all the important structures. It was like, gosh, this guy, he can't even kill himself. Even though
Yeah.
he tried. I mean, it was kind of a sad situation because the guy is still alive, and now he has a big, handle of a glass in his brain. We took it out, and He
Wow.
lived, and the only thing he suffered was he damaged his muscles of the eye.
Right. And he had to get a new pair of glasses, right?
Well, can he even see? Can he even see out of the one eye? I'm guessing
Yeah.
it's one.
No, he could see out of those with both eyes. The only thing he missed is
Wow.
the only thing he damaged was the muscles of the eye, so he couldn't move his around his the eye that was affected as well as the other one, but the vision was
Wow.
intact.
That's pretty amazing surgery to get it out without damaging anything, right?
Yeah. Well, again, he had to go to the endovascular suite, and they were doing it under radiographic monitoring, and they took it out.
Talk about the evolution of robotics in surgery, even during your career. You've been practicing medicine about as long as I've been practicing law. That probably wasn't there when you started, and now it's like an everyday part of what you do, right?
More or less, yeah. So for me, I trained to do, for example, my surgeries without any robotics. Um, so the robotics are mostly for spine. I mean, they use it also. They're starting to use it for brain surgeries, but it's mostly in spine. You don't need them. They're just there to assist you. So you can use them with assist. Um, so it does help with planning. Right now, the way the robots help is that you can pre-plan your surgeries, and it kind of makes it smoother when you're doing the surgery. So you don't have to think as much because you already planned it. So they have a robotic arm that comes, and it's like positions perfectly where you are. You go and drill into the spine and put your screws there. That's how the robotic helps you.
Nice.
Navigation has become a bigger, that one is older than robotic, but navigation has been very big, and it plays a huge role in the way. And what I mean by that is, so we register the imaging of the brain, the patient's brain, and then we register the head to this computer. And there is these, we have like little cameras that the registration device has. So it kind of three-dimensionally is able to see the head or the spine if you're doing spine surgery, and integrates your pre-op images to that. So it's able to navigate you to locations, and kind of be able to see through. For example, if you look at the computer, you know exactly if you go this direction, you're going to end up in that part of the body.
Nice.
So that's been huge. So that's becoming, especially for cranial surgery, that has become a standard of care almost.
Can you, like on my navigation, I could pick like an Australian accent or like a British butler guy. Can you pick different voices, or how's that work?
No, no, unfortunately, no. There was one device that I saw few months ago, actually, maybe about a year ago. It was made in Canada, and but it was somebody who programmed a Canadian. What did they say? Yeah,
Hey, yeah,
somebody put that in there. So when you turn it on, it would say that. But
that's pretty.
otherwise, no. They don't
Uh,
talk to us.
well, Liv, we got to let Dr. Chahlavi go in a minute, but do you want to get any free medical advice before we leave?
No, but I guess I have one final question, and it's not a medical question.
Uh,
It's a fun one.
okay.
Okay. What is something that you or like neurosurgeons do in your daily life that like a normal person would think is strange? And I can give you an example if you need one.
Yeah, what's your example?
I'll give you an example. Like for me as an attorney,
And she's weird.
I like to edit like menus at restaurants and then like turn them in and say like, you should probably like
I see.
correct your
Oh,
grammar.
right. Like, do you bump into people and you're like, I see some pressure behind
Yeah,
your eye.
like
You should really come in to see me.
or like when you're cooking, do you like use your knives like that? Someone
Ah,
regular would be like, huh, that's
yeah, when you go to
really.
Benihana's, you're like, you're holding the scalpel wrong.
Yeah. So, well, obviously, because of the knowledge we have in neurology, and um, if I see somebody with a movement disorder, I'm like, is this, Parkinson's, and or somebody has a little bit of weakness or facial spasm. I mean, obviously, I start diagnosing. It's normal. Obviously, we use our knowledge to diagnose. But when it comes, I'll tell you, when it comes to cutting, it's the family. If family and friends, they think like if there's anything to be cut, they're like, oh, we got to call Ali. Let's Ali cut this. I'm like,
At
I mean,
Thanksgiving.
I'm a surgeon, like it's not like I'm a master cutter and everything. So when it comes to Thanksgiving, I'm the cutter. I'm the turkey cutter. I mean, that's it.
Are you any good
It's
at
like
it?
always me. It's like he needs to cut the turkey, and I'm like, okay, fine. But it's not like I don't know specifically how to cut the turkey. I'll just cut it however I like it. Then
Yeah, the turkey's already got no head.
20 years, every year at Thanksgiving, I'm the cutter.
Yeah. Does that make it harder for you to break the wishbone? I mean, that would be tough, wouldn't it, for you?
Yeah, I don't even break the wishbone. I just cut for them, and I'm like, all right, that's it. I'm done. I'm sitting down.
And they all clap. Yay!
Well, you are a good sport, Dr.
Yeah.
Chahlavi. I've always enjoyed your company, and thanks for coming on and talking about your first rodeos.
Thank you.
No, you're welcome. Thank you, guys. Have a good
Bye.
night.
All right,
Thanks,
brother.
Doc.
Talk to you later, Ali.
My first rodeo. My first rodeo. My first rodeo.
Well, that was a sell out. Get it?
Really?
CELL.
That's
out.
where you're going to go? Yeah, I guess. I don't know. He didn't talk much about cells. He had a lot of medical terminology, though. That was,
Yeah, we were like,
We did. That's, I got nothing to add to
I
that.
want to watch him cut Thanksgiving turkey. I wanted to be like, can you please record and send that to me next
Oh, that would be
Thanksgiving?"
good.
Like, I think that'd be a famous TikTok channel.
Yeah, but I mean, that turkey's been cooked. He's not generally cutting and cooked people.
I'm sure he does it better than you or I do.
They should really, I mean, they should ask the mortician or the, what do you call the doctor who cuts people when they're dead?
Yeah, like the autopsy guy.
Yeah, what do they call it?
Mortician, yeah.
No, the mortician works
Coroner.
at the funeral
No,
home.
what's the coroner's office?
Coroner or the, there
Medical
was,
examiner?
when I grew up, there was a
I
show
don't
called
know.
Quincy, which was basically kind of like a CSI Miami, but it
Mhm.
was all about what he would find in dead people. Anyway,
Yeah.
they should ask that person to cut the turkey.
Yeah.
That
Well,
personally-
that was really cool. I feel like I could have talked to him forever.
Yeah, he's fascinating.
Yeah.
Really nice.
Uh-huh.
Obviously, we can't ask as many risque questions about a
Yeah.
man who does surgery on a daily
Yeah.
basis.
Next time I go for my appointment at where he works, I'm gonna like see if he's in his office and go stop by and say hey.
That's good. Is
Yeah.
that what you're going to say just like that? Like a
I'm-
sexy starlet?
No, I'll
Hey.
just be like, hey, I just came from my neurology appointment.
Yeah, that's true. So you think you go to someone in his practice?
I do.
That's
And I
cool.
don't go
Why
for
do you got to tell us why you go to a
Yeah,
neurologist?
I do. I'll tell you. I go for
Alright.
my migraines.
Listeners, I need you to sign a
Yes.
HIPAA waiver at this moment.
Yes, I've always had horrible migraines with
that's not good.
auras, and I'm on this thing called Amovig where it's an EpiPen, and I give it to myself monthly,
Oh, no.
and it's a migraine prevention. And then after that, I have to take other meds if I
I'm
actually get a
sorry, Liv.
migraine, because like my migraines are just so uncontrollable.
Uh,
So yeah, you
that
gotta
sucks.
go for the Amovig once a year.
yeah, that's not a good thing.
No, but yeah,
Man.
yeah, migraines suck.
Yeah, they
If
do.
you have them, I feel for you.
Yeah, no, that's not a good thing at all. So you go to the neurologist and
Mm-hmm.
they give you some magic?
Well, yeah, I mean, I've gone since high school because I got my first migraine in high school and it was a total aura. And I was like, oh my gosh,
Right.
what is happening? Like, you lose eyesight, like, you get physically sick and you just want to be in a room by yourself for 12
Right.
hours. Like, I missed so much school.
And yet you're still not a big fan of science.
No, and like, I picked the worst career for myself. All I do is look at a computer screen all day and read.
Right,
Like,
right.
literally
And
gives
deal with
me
people that are arguing.
gives me
or-
migraine. So I have
Right.
to be on like the strongest migraine drugs there
Right.
ever is. But I wear blue light glasses,
Yeah.
which I don't know if you guys wear them,
Uh-uh.
but like ever since I started wearing them,
It
they
helps.
make such a significant difference. If I take them off, it's like, oh, like the computer screen.
Yeah.
I don't know how I did all of law school without them, but like shout out to blue light glasses.
That's a good thing. A potential sponsor for our show again. But what makes you so antagonistic towards science that's keeping you from having repeated migraines?
You mean why don't I like science?
No, you don't believe science.
I don't. I think science is a conspiracy theory.
Right. The whole
Because-
everything E equals MC
Okay,
squared and all that
We're in a
stuff.
room right now,
We are.
and do you see particles? Do you see, like, how do you see
Uh,
particles and cells and neurons and atoms and like, there's no, like, it's just made up to
I don't
me.
see a lot of things.
Like, the stuff in science
I don't
books,
see electricity, but the light's on.
it's sort of like God, like, you can't see it. So how do
Right.
you know
It
it's
doesn't
real?
make it a fiction. It just makes
But
it.
how does it make it nonfiction?
So your point is only things you can. I mean, there is a fiction. You have to narrate it. Like George Washington was the first president.
I like to
Never
see,
seen him.
I don't know. I like to see things, and you can't see science, and like the math of it is just ridiculous.
Alright.
And
So you're a visual learner. You like
oh
tangible
yeah, I
things.
like PowerPoints. I
Right.
like graphs.
Right.
I'm
But not
very
everything you can't see is fake. Like if I walk out of the room, I still exist, right?
Yeah, like I believe in ghosts.
Yeah. Oh, that's reconcilable. All right.
Like I believe in ghosts, and I do believe that like back in the day there were mermaids. I don't think that they
Back in the day, what day was that? Was that the
Please,
Leave
I
It to
mean,
Beaver
like,
days?
I don't think that they look like Ariel. I think they look like creepy fish things. But like I definitely believe in
Right.
things I can't see.
Right.
But I don't like somebody telling me to believe in something where I'm like a neuron. I
Yeah.
can't see that. Or like, how do you know a proton's positive?
Yeah, I don't know.
Like my husband says I need to go back to like 3rd grade science, and you know what?
Probably.
I probably do.
It's okay. It's fun having you this way. I was doing a comedy show a few nights ago, and it was there were kids there, and this kid came up to me after the show, and he said, "You want to hear a joke?" And I said, "Yeah."
No.
And he said, "Why does the Little Mermaid wear seashells, for her top?" And he said, "Because the B shells are too small and the D shells too large." I thought that was pretty good.
I had a joke, but I forget it.
Yeah.
Oh, I made it up. What? How does a cat like its steak?
I don't know. Cats eat steak.
Wait, no, that's not. How does a lion like its steak?
I don't know.
Rawr.
Rawr. Oh, that's good. It could be a pirate as well. Ladies and gentlemen, thank you for joining us for this episode of My First Rodeo. Hope you've enjoyed.
Somebody get me some Advil. I'm done.
Dr. Ali Chahlavi. See you later, Liv.
Bye.
My